This is the Bartholomew Town Podcast.
Hey everybody, welcome into another episode of the Bartholomew Town Podcast. It's Bill Bartholomew here with you for another edition of Inside Rhode Island Public Health, presented by Commonwealth Care Alliance, where today we discuss a new partnership between CCA and Lifespan that, amongst other things, addresses social determinants of health. And boy, haven't we learned about that throughout COVID-19 and so many other issues that have played out in recent times. We're joined by CCA's Corey McCarty and Lifespan's Dr. Alan Kurose. And this is a fascinating conversation, again, going deep into, I don't want to say deep into the weeds, because that sort of, sounds like inside baseball. It's stuff for all of us to learn about and pay attention to. But just trying to look at areas of public health that aren't necessarily on the front page of the paper or something like that. That's the point of this series, and we've been getting some great feedback on it. And again, after all we've been through in terms of COVID-19, I feel like this is so pressing an area, a subject matter that we should be addressing as often as we can, not only in a media context, but I think just all of us talking about it and thinking about what works, where do we see our healthcare system going, right? And there's big picture issues and there's acute issues, and they all work together. And man, have we learned that, if nothing else, over the last several years. Inside Rhode Island Public Health is brought to you by Commonwealth Care Alliance, Rhode Island. Commonwealth Care Alliance, or CCA, is a multi-state integrated care system influencing innovative models of complex care nationwide. CCA's Uncommon Care model focuses on sustainable and evidence-based healthcare breakthroughs that improve the health and well-being of people with significant needs, and is consistently recognized as one of the best models in the country at identifying and serving traditionally hard-to-reach individuals. CCA is excited to bring Uncommon Care to Rhode Islanders with a range of Medicare Advantage plans. To learn more, visit www.commonwealthcarealliance.org/Rhode Island. All right, so today we continue our recurring series each month here on Bartholomew Town, Inside Rhode Island Public Health, presented by Commonwealth Care Alliance. And let's get it started with the intros, if you will. Let's see who goes first. This is always fun to see who jumps in first and introduces themselves.
I'll defer to Al. Al, you can start off.
Great. Good morning. This is Al Kurose. I am the Senior Vice President for Primary Care and Population Health at Lifespan. I've also been the President of Coastal Medical since 2008. I am a internal medicine physician by training. I actually practiced primary care in a community office setting here in Rhode Island for 20 years. Happy to be here. Thank you.
All right. My name is Corey McCarty. I am the General Manager of Rhode Island for Commonwealth Care Alliance. I've been working in the industry in Rhode Island specifically for about 23 years in various forms of healthcare, health insurance, and more specifically the last 10 to 12, really focused on supporting individuals, older adults, and individuals with severe chronic conditions and or living with disabilities.
All right. So let's begin with an overview of Commonwealth Care Alliance's efforts and presence here in Rhode Island, which is emerging in recent times, so to speak. I guess, Corey, you're best equipped to sort of summarize this for us. And let's start with, what's your mission and how does the organization work to advance that mission?
Thanks, Bill. Yeah, so Commonwealth Care Alliance is a little different than maybe other organizations that we've seen in Rhode Island. We are both a health plan as well as a provider. And so we describe ourselves as a national multi-state healthcare organization. And we've really focused on our expertise on complex care coordination and delivery, which is important when you think about the populations that we traditionally serve. So we traditionally have focused on those individuals with significant health needs, those individuals living with disabilities or chronic conditions. And we've really gotten national recognition for our model of care supporting those individuals and really helping them improve their care. And in addition to improving their care, it's really about engaging individuals who are sometimes difficult to outreach to or to get in touch with. And that's really where our focus and expertise has been. In Massachusetts is really where we made our name with our dual programs. And those are described as duals for individuals that are both eligible for Medicare and Medicaid. And so they are called dual eligible individuals. And we run two programs for the state of Massachusetts, the One Care program and the SCO, Senior Care Options program. And those are for individuals who are under 65 and both dually eligible, as well as over 65. We also run Medicare Advantage programs as well across the country. And so when you think about what, in essence, what it is that we do, it's really about creating simplicity for our members. And that is at the core and the heart of what we do. So it's patient-centered and it is simple. So as you think about healthcare is really complex. Then you start layering on things like food insecurities, housing insecurities, lack of transportation, lack of ability to pay for utilities. That all makes things really complex in healthcare. And so our job is to help work with the existing provider delivery system to connect the dots and simplify that for our members.
So people have probably started to see the ads on buses. They've heard spots here on Bartholomew Town and other places. So the presence is starting to become, more common to the average person. But how long has CCA served the Rhode Island market? And why did you decide to enter this space to begin with?
Yeah, I would assume at this point, everybody's seen at least one of the bus shelters or the bus kings, the bus wraps out there. We started back in late 2020, really starting to build up our clinical team, working with provider partners to establish a network, and also talking to state healthcare leaders to figure out exactly how we were going to enter the marketplace. We officially entered this past January with Medicare Advantage plans and a dual special needs plan. And since then have really been actively working across the marketplace to establish our brand, to support the members that have enrolled with us, and then to partner with Lifespan as an example and Coastal Medical to really be able to deliver the consistent experience and the consistent network and needs that our members have in the state of Rhode Island. We think that the state of Rhode Island is such a unique spot for us as we think about the model of care we have. We think we have such a unique solution that it fills the gap. And that actually was why I came to Commonwealth Care Alliance. I came here because I thought, and as I looked into the Massachusetts market, that the solution that they were delivering on behalf of the Massachusetts market could be ported into Rhode Island and would be able to make a drastic difference in the overall lives of our older adults and people living with disabilities in Rhode Island.
So recently, Commonwealth Care Alliance and Lifespan announced a partnership. Let's talk about it. What does the agreement entail and what are you aiming to accomplish?
So we've been connecting back and forth for the better part of a year. And for us, it's really working with Lifespan and Coastal Medical to really think about how do we deliver care differently for these individuals. When we talk about these individuals that I described earlier, those individuals living with complex healthcare needs, those individuals that are perhaps struggling to be able to consistently have housing on a monthly basis, consistently struggling to be able to have food, it makes it really challenging for the providers in the state to really be able to deliver their expertise. People aren't going to focus on medical needs when they're struggling to be able to ensure that they have housing on a consistent basis. And so really, as we look at this partnership, not only do we participate together, but we also look to how we can help complement what Lifespan is already doing so well in the market today. Al, would you add anything there?
Yeah. So, I think there's an awful lot in what you've said in the last few minutes, Corey. Certainly one of the things that we see at Lifespan is that there's great alignment between our approach to care delivery and what Corey just described. And we believe also that it's a good thing for patients to have choice. But I'd step back for a second and call out some of the things that are inherent in what you described, Corey, that are so different from the way that we've delivered healthcare historically, right? Because it wasn't that long ago that the model of care delivery was that a patient would come into an office and they'd be on the provider's schedule for the day, and the provider would sort of address particularly in primary care, let's say, that would provide the provider would address the concerns of the day. But what Corey's describing and what we're what we're doing today at Coastal and at Lifespan is we're taking a proactive approach to the health of populations. And there's so much more that goes into that than just addressing what we used to and still call the chief complaint of the patient when they come in. It's like, why are you here today? Well, okay, I've got a cough, or I've got shortness of breath, or whatever. We're taking a few steps back and saying, look, as a healthcare delivery system partnering with a payer, we're going to make ourselves responsible for the health of this entire population and each of the individuals within it. So, we want to think about giving people the right care in the right place at the right time as much as possible. We want to do that in ambulatory rather than, emergency department or inpatient settings, because it's more convenient, it's safer, and if we do it well, it's more timely. But then there's all these other layers of recognition and support when it comes to things like transportation challenges, food challenges, challenges in the home environment, access to care, equity of healthcare outcomes. All of that is sort of wrapped into this more holistic approach that we want to take both on the delivery system side and with progressive payers like CCA. So I just, you don't want to miss the forest for the trees, right? This is new and different. And we think it's a much more informed and thoughtful approach, particularly to the care of patients that have multiple complex chronic conditions and challenges, whether they be multiple medical conditions, whether it be some of these social determinants of health, as they're called, that we're talking about, challenges with transportation and food insecurity and the like. So we look at CCA's track record, and we note that they're really sort of one of the leaders in the industry and very accomplished in this area, which was part of why we thought that connecting here would be in the best interest of patients.
And Doc, where do you see this going in the future in terms of next steps for this partnership? I'll yield to Corey in a minute. We're just starting, so we need to get some scale in terms of the number of patients that we're serving. And I think it's a beginning of a journey where we'll each learn more about the other, but there's been a lot of diligence already. And again, I think that this is about healthcare delivery systems and payers together, making themselves accountable for the kinds of outcomes that we want to see for individuals and populations, and to be particularly thoughtful about what we would call segments of the population, subset of the populations, where really the needs may be unique and significant, and we've got to systematize our approach to that. There are lots of people on the provider side and on the payer side who will sort of individually make heroic efforts to serve the needs of a patient, which is a great thing. But ultimately, what we want to do is systematize this so that we're measuring our performance in meeting these different goals for patients and populations. We're systematizing an approach that respects and accounts for individual preferences in terms of the goals of care that each patient has. And so making this the new normal, systematizing it, putting the supports and the resources and the programming in place is really where partnerships like this one need to go. And I know that CCA and Corey would support that.
Absolutely. And very consistent and well said, Al, in terms of our focus as we go forward. I think, what we've done and what we've brought to Rhode Island is really a platform to listen and learn. I think a lot of times people from Rhode Island, I'm a native Rhode Islander, tend to look at the Rhode Island, state of Rhode Island and what we have in it, and look at ourselves maybe a little less fondly than we look at other parts of the market or other parts of the country. And what I've always been impressed with, and I continue to see, is the Rhode Island healthcare delivery system is excellent. The care that's delivered here is second to none. And, when I look at what we have the ability to accomplish in Rhode Island, we are a small state, which makes it the possibility to integrate and deliver something much different, a much more real possibility. And that's something I'm committed to, and anything that CCA can bring forward with our partners like Lifespan to be able to do that, to make the care even better than it already is what we're committed to doing in the state of Rhode Island.
Kind of continuing on that thought here, even for the rest of this conversation, let's talk about Rhode Island's healthcare system as a whole. It's been mainstream news over the last several years on several levels. One, the merger, the hospital integrated academic healthcare system, and that potential, and other similar merger conversations or hypotheticals and so on and so forth. And then, of course, COVID-19 and what that sort of taught us about our healthcare system. Let's start with the most pressing gaps in Rhode Island's healthcare system, and then sort of segue that into some of the key takeaways that your organizations learned throughout the COVID-19 pandemic.
Sure, there's a lot to unpack there.
Yeah. See you in 4 hours.
Yeah. I'll let Al take the lead on this one. Al was really, he and his organization were really most front-facing and patient-facing throughout the pandemic. So certainly let him take the lead in what he learned and what he saw.
It's a great question. It's been a very demanding time for healthcare delivery systems. Just the begin with some of the obvious and fundamental things like the risk exposure of frontline personnel, and the learning that we needed to do over a couple of years, because what we understand today is very different from what we understood at the outset. And of course, now, we have more effective treatments and we have vaccination, which has really reduced the severity of the typical case of COVID. But, some of the takeaways, I think that, access to healthcare continues to be a problem locally, regionally, nationally. We had to do some unique and innovative things very quickly at the beginning of the pandemic so that we could continue to serve patients. One of them was a very rapid pivot to use of telemedicine, telephonic care, video conference care, because as we were sort of learning what was safe and putting in infection control sort of workflows, we had to very quickly make sure that our most vulnerable patients were safe. So at Coastal, for instance, we went from doing just a handful of video conference visits on a trial basis to doing, thousands every week virtually within a couple of weeks. And so that was sort of a big pivot. And I think what that did was it established telemedicine as a piece of our healthcare delivery workflows that is likely to persist indefinitely. I think right now we're doing maybe 15% video conference or telephonic visits now because we've established the workflows and we have a safer workplace environment. But there's an element of convenience and efficiency there that I think we're going to want to maintain. I think that the pandemic unmasked disparities in healthcare access and healthcare outcomes based on zip codes and race, ethnicity, language, disability. I think part of the work that we all need to do as a healthcare delivery system in partnership with payers and regulators is to increasingly measure the outcomes and improve them. There's sort of a maxim in quality improvement and process improvement work that you can't improve what you don't measure, and we're starting to do that. One good example is in the accountable entity Medicaid ACO program here in Rhode Island. We are now starting to look at our quality performance data and analyze it across race, ethnicity, language, and disability status. So we will start to have some objective parameters to hold ourselves accountable. So again, when you look at, and you're right, we could talk hours or days on what we've learned from the pandemic, but a couple of quick ones then are the pivot to telemedicine and the likely persistence of that, the spotlighting on disparities. And I want to give a shout out to the Rhode Island Department of Health in terms of some of the sort of hot spotting they did in terms of looking at testing and immunization for the most vulnerable populations and communities and prioritizing that. I think too that there's a persistent strain on our healthcare delivery systems right now because we had, quote, the Great Resignation. We had about 20% of the people working in healthcare nationally just left the workforce. So we still have workforce constraints, which means that at any given time, you may not have all your operating rooms open, or you may not have all your floor beds or ICU beds available. And that's caused financial stresses, which really sort of highlight that the healthcare delivery system here in Rhode Island economically operates on very thin margins. I won't geek out too much on healthcare policy, but I'll just mention that data became available recently from the National Association of Healthcare Policy about hospital system operating margins in Rhode Island over the last decade, and they tended over that 10 years to have a median that hovered around zero, actually, for operating margin. And so we understand that whatever the sort of popular impression may be, the fact is that healthcare delivery in Rhode Island is really chronically on very thin operating margins. And I would say that the fundamental reason for that is the inadequacy of public payer funding, particularly Medicaid rates. And so, that too is sort of a reflection of what we've learned from the pandemic, because it just made everything a little bit more difficult financially. And I think that's unmasked some of these sort of longstanding issues that we can now hopefully collectively as providers, payers, regulators, all sort of lock arms in the public interest. We can look at these questions and get a healthy, sustainable delivery system that can sort of optimize the care of patients and populations. So there's a lot there, and we could talk for hours, but I'll stop.
Yeah, it's a good thing we're doing a monthly series here, because we'll certainly be tackling a lot of those issues at minimum once a month, I would say, going forward. I want to close out here, last couple of minutes, sort of a buzzword in healthcare, and something that is, we've pretty much discussed at length today already, but that's social determinants of health, zip codes, so on and so forth, background, disability, and so on, whatever it may be. How are your organizations working to address those? And then in turn, how can providers such as Lifespan and insurers such as Commonwealth Care Alliance work together to promote healthcare equity in Rhode Island?
Sure, I guess I'll start. So yeah, it is the buzzword in healthcare today, social determinants of health, but it's really, in essence, where you live is a better indicator of the outcomes and the healthcare that you would get than any of your background or upbringing. And certainly that has been the focus and the specialty of what Commonwealth Care Alliance has done and how we've made our reputation throughout the country. Our focus, if you look at it, about 11% of our population in Massachusetts is homeless. That is a focus of what we do, and day in and day out, our care team. So we are actually sending clinicians into the home. It could be a licensed social worker. It could be a behavioral health specialist. What we've found, and Al described many of those things that really were exacerbated throughout the pandemic, is the need to get into deliver community-based care is critical. And when you have to break down silos that are things associated with social determinants of health, it really requires you to be in the community to have those conversations, to understand what the real challenge is that you're dealing with. And for us, that's core to everything we do. The first time somebody onboards with us, we're asking questions about what their situation looks like for housing, what their situation currently is for food, what their utility situation looks like. It's, a real hot weekend over the weekend. Do you have air conditioning to be safe in the setting that you're currently in? Do you have transportation to get to your provider's office? And that then gets personalized every time we have an interaction with that customer, with that patient. We are sending clinicians in to address those specific issues. And I would say, beyond that, behavioral health really became a key part of what we knew we needed to do. And while we were doing it incredibly well before the pandemic, our older adult population lived in isolation for about a 3-year period, which really magnified the need to step up and be able to make those resources available for individuals. And that combined with something that Al said, telemedicine as a basic tenet of how you deliver some of the care, we need to make sure that people have access to Wi-Fi to be able to have telemedicine. For those of us who have that, we take it for granted that's a core part of our daily living. That's not a core part of everyone in the state of Rhode Island. That's something we need to make sure that becomes a reality as we go forward so that we can create these interventions for those that may not feel comfortable or incapable of leaving their home. So that's where I would say we are and where we're focused. And we're looking to partner and be able to extend our model of care to partners like Lifespan and Coastal Medical to ensure that we can make sure those services are available to everyone throughout the state of Rhode Island.
Doc, you've got the last 60 seconds here on that issue or anything similar to it.
I think this is going to require a multifaceted approach. You can look at what CCA has accomplished in Massachusetts, and it's really extraordinary, some of the work that they've done in addressing social determinants of health. At Coastal, we've got a multidisciplinary home visit team. We are partnered with some community-based organizations that can deliver these services to patients. Lifespan's got the Lifespan Community Health Institute, which has done some great work. So I think that ultimately you're looking at a situation with providers, payers. You're thinking about healthcare policy and public policy in general, including economic policy. All of these things are going to converge in our attempts to better support vulnerable populations. We're going to need those partnerships with community-based organizations too, because payers and providers cannot provide everything that patients are going to need. So, even things about policy and structure around public transportation come into play. But the thing is to be looking and asking, right? We have this Unite Us platform now that we can use to give us structure for our inquiry into social determinants of health with patients. But we have to also understand when somebody tells us they have a problem, we have to know what to do. We have to at least give them direction. Do we direct them to their payer, like CCA? Do we direct them to a community-based organization? Do we as a provider entity have resources to bring to bear? But this again is a sort of a burgeoning area in healthcare delivery. I love it because it's a righteous undertaking, and we can look at ourselves as a society and be judged based on how we care for the most vulnerable amongst us. And I think that this type of work and this type of partnership we're talking about today sort of is in the interest of those kinds of considerations and the support of vulnerable individuals.
A partnership between Commonwealth Care Alliance and Lifespan. This is Inside Rhode Island Public Health, presented by Commonwealth Care Alliance here on the Bartholomew Town Podcast. Gentlemen, thank you very much for your work and for being here today.
Thank you, Bill.
All right.
Appreciate it. Thank you, Bill.
A pleasure.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.